We are with the chairman of the Nigerian Medical Association, Dr. Oreyemi Ifedayo. He is a chief medical officer at the Ekiti State University Teaching Hospital. Doctor, you're welcome to Puff Television.
Thank you very much. Good afternoon, sir. And Good afternoon to all our viewers as well.
Thank you very much.
Yes, sir.
Doctor, how would you evaluate the medical practice today as compared to perhaps the period before you came in or even after you came in, and what it is like at the moment, medical practice?
Medical practice has advanced over the last couple of decades, and the services that have been rendered by medical practitioners, doctors and dentists within Ekiti State, the scale of it has expanded significantly in leaps and bounds since we joined service close to 2 decades ago. When I joined service in the 2005, then when I came to Ekiti, the total number of doctors that was in the entire state was not up to 160, including all the general hospitals, the Federal Medical Center then at Ado-Ekiti, and then the state specialist hospitals. Total number of doctors, it didn't exceed, we were not up to 200, way under 200. But right now, as we speak, Ekiti can boast of nothing less than 800, 900 medical practitioners in different fields, whether it be public or private practice, or whether within the specialist hospitals that we have, the federal and the state, or the general hospitals and the what's called local government service commission through our basic and comprehensive health centers. So the staffing has been very much more improved, and the range of services being offered has been very much more expanded. Now we have specialists in different cadres of medical care that before 2 decades ago, if a family member of anybody had a stroke or had any injury or ailment that required specialist care, you had to go all the way either to Kwara, to Ondo, or to OAUTHC in Ife or Oshogbo to access care then, because those were where the specialists were then. We had very few consultants within our state. But right now in Ekiti State, I can boast of us having nothing less than 250 to 300 consultants in different specialties in different parts of the state. There are those in Federal Medical Center Ikole, those in Federal Teaching Hospital Ado-Ekiti, those here in the hospital, State University Teaching Hospital, those in Abuad, and you can access care even in the Hospitals Management Board. We have specialists and consultants that work for us at Ikere, at Ijero, and this has really given better services to the people of our state and our communities, that they don't need to leave Ekiti to get access to this kind of treatment and care anymore. They can get it right within our vicinity nowadays.
Are you saying that the syndrome of Japa among especially the medical practitioners hasn't had an effect on the population of doctors in Nigeria or in Ekiti or everywhere?
Japa has affected everybody everywhere. We have suffered it immensely in Ekiti. There was a point in time in our hospital that we could boast of more than the total number of doctors, more than 250 or 280 at one point in time, because the numbers were there, specialists were there, people were staying. But now we struggle to even boast of 200. Because at one point in time, we lost more than 60, 70 of our very good hands, consultants, specialists, resident doctors, medical officers who left the country in our facility here. Federal Teaching Hospital is even more badly hit. So there are some departments in Ido that we have been advertising even for doctors who are in residency training to come on board, to come and start their program and everything. There are spaces to accommodate more than 30 people in some departments, and you have barely 3 people applying. Out of the 3 that apply, barely 1 will come to resume. It is that bad. That is the impact and the scale to which Japa has affected us. And everything boils down to the remuneration and the welfare that doctors enjoy within the country, which has been a very sorry and sad tale to tell over the past decades, even till now.
Very soon, we may not even get surgeons to operate in our theaters. We may not get nurses to attend to our patients in the ICU. That very soon we may not get perioperative nurses or nurse anesthetists, to deal with the need that we have in the theater. Very soon, we may not have doctors, we may not have nurses to actually address or attend to patients.
You know that it's not enough to just preach to a new graduate of medicine to stay. What should be done practically for them to be attracted to medical practice in Nigeria?
The one thing that can be done is when they see their own trainers being taken better care of and receiving good care from the federal government and the state governments. When you see a whole professor of medicine as at now earning some salaries that cannot be mentioned, for somebody that has given more than 15-20 years of academic research in the field of medicine, I have to specify that in the field of medicine, research work entails a lot of investment and funding, and most of our members have to engage in this research work with personal resources. Grants and fundings have not been so freely flowing within the country like they used to in the 80s and in the 90s. So people have to invest personal resources to ensure that they progress and they add more value to themselves. And by the time, at the end of the day, with all the investment, your remuneration is nothing to take home about, or to talk about. And when the professor of medicine, we have instances in which professors of medicine in the last 2 years have left the country to go and start as residents in the UK and the US.
Professors of medicine.
Professors of medicine. Like I mentioned, 2 or 3 of them that we have heard about and we've seen across the country. And that shows you how bad the system is, that if our top brains and our top hands have to leave the system because welfare and remuneration is not taken care of. It is not enough for us to just build hospitals or buy highfalutin instruments, CT scans, MRIs, and install them across the state. The person that will be manning them also requires to be taken care of. So you need to talk about the welfare and the remuneration for the workforce as well.
What we can do to ensure that we do not lose everything, even if our people decide to go. Of course, production must also increase. And this production that has to increase, I'm talking about in terms of health workforce. The production that has to increase, also we must begin to look at specific need of this country.
Do you feel strongly about any issue concerning Ekiti and its people?
Ekiti State belongs to us all.
Do you hold any opinion that will advance the cause of the fountain of knowledge?
Contact 070-683-99526. People of the fountain.
Are you saying from the period of the removal of subsidy, which has resulted in an increase in allocation to all the states across Nigeria, there has been no improvement even after wage increase for workers in the aspect of medicine?
Now, for the aspect of medicine, I have to speak, being the chairman of the state, I have to speak in 2 different angles. For our federal civil servants, our federal workers, doctors working in the federal civil service, they have enjoyed little or no benefit at all from the federal government after the increment in subvention, what's it called, a removal of the subsidy.
Yeah.
The only thing anybody got was the 40,000 naira minimum wage, whatever was added to their salary. Which
after the 40, we now got to 70,000.
That is, in the federal civil service, that's 70,000. They just added 40,000 naira to doctor salary. That's what they did. That's what the federal government did to federal workers, and that was even taxed, such that so many of our doctors didn't even get 40,000. They were getting 32, 33, 34,000 naira. It wasn't even up to 40,000 increment, and fuel had gone up from the usual, was even 160 something that we're buying it, to 900. So now we were still talking about it in the forum that we were yesterday, that once a doctor receives his salary and he pays school fees and buys fuel of 40 or 60,000 naira, by the 4th day of receiving that salary, he is broke again. He has to start looking for how to just survive the month and how to just make do for the month, which is a very sad tale to listen to, because this is somebody that will be sitting and making decisions on human life day in, day out, and he is not motivated to work. Because he's a family man too. He has a life too, and he's looking at his life just not being attended to or being catered to by his employers and the people that have employed him. That is the sordid tale of our doctors that work with the federal service. Now, coming to our doctors that work with the state civil service, both at the primary, secondary, and tertiary level, we need to give kudos to the government of Ekiti, because the government went ahead to implement a particular wage restructuring for the doctors working in our civil service when we saw that we were not attracting enough doctors anymore. People were leaving in droves. So through the Honorable Commissioner of Health, we were able to get a package salary that was equal to what federal health workers were also earning. So that was what brought up the value of what doctors working with Ekiti State Civil Service earned. It just came to be at par with the federal service. And now even the federal service is nothing to compare about. So in the long run, in as much as we are appreciating the government of the state that yes, they have come to be at par with the federal service, by the time the minimum wage was being paid to all workers within the state that was approved, we were not able to get anything, because now our salary is supposed to be just at par with federal civil service, and until the federal civil servants or federal doctors earn an increment, we will not get any. And that has already led to the condition of JAPA affecting us more, because now people are still leaving state service again because they feel that they can get something better outside the country. So for us to attract the top hands and the top brains and to keep them within the system, we need to do better. The federal government went to St. Lucia and saw the state of things, and they were promising aid to St. Lucia by taking doctors working in our sector here, in our country here. You took them to St. Lucia and you are paying them almost times 7 of what they are being paid in Nigeria. And what even they are paying them in St. Lucia is still like times 3 of what the Nigerian doctors that are brought there are earning. You increase salary, somebody that was earning less than, let's say, somebody that was earning 1 naira in Nigeria, you took him to St. Lucia and you promised him you will be paying him 7 naira. Whereas doctors in St. Lucia earn 15 naira. But
so they are still underpaid.
They are still underpaid in St. Lucia. But that's now our argument. That's the argument of Nigerian Medical Association. Okay. So if you know our value, that we actually deserve more than 1 naira and we deserve 7 naira, according to international standards that are still a little bit understandable, then why can't you pay it here? Why can't you pay it here? And yet our political office holders earn more than their contemporaries in the UK, US, and all other parliaments. So that is a challenge that we have already tabled to the Ministry of Health, the Ministry of Labour, and the federal government, that there is a need for a review of the wage structure for doctors and dentists in the country, for us to keep our hands here. Our medical students are already reading for professional exams from Part 5 and Part 6. They don't want to stay in the country. Once they just do their youth service here and they've served their fatherland like this, nobody wants to come back into civil service. Nobody wants to stay behind. There are opportunities everywhere. Australia, Germany, Canada, Sweden, everywhere is attracting Nigerian talents, because they know the training of medical doctors in Nigeria is comprehensive and detailed. So our doctors get job offers within a short period of time when they qualify in those countries. And we are at a loss here, looking for hands to come and help us attend to our people.
Doctor, you yourself are a young man. Are you also considering relocation? Well, I believe I've been patriotic enough to have continued offering my own services and that of my own family to our people and to my nation thus far. But if you ask me if I don't have regrets, I will tell you I have a lot. I wish I had left when all my peers left. Because the difference in remuneration and what they can afford to do for themselves and for their families compared to what we in Nigeria can do for ourselves and our families is a whole century, is like millions of light years apart. Nigerian doctors, we barely are surviving. We are barely getting by. We are like an endangered species. We have so much responsibilities that we bear. Because even as you are working in the system, not only are you catering for your own kids, you are caring for kids and of family members and relatives, kids of unknown people that still all come to you to ask for support. And even in the hospital, doctors are bringing out monies from their pockets to support patients on bed who cannot afford care. There are so many wards in this our teaching hospital in Ekiti where visit the pediatric ward, especially either the children emergency or the children's ward or the gynecology ward, where our doctors work. You'll be seeing our doctors bringing out, doing money around. Consultants will be, okay, me, I'm dropping 2,000, I'm dropping 1,500. Just because we need to buy drugs for this patient. This patient must not die. This patient must get better. But who do we tell those tales to?
This program intends to bear the torch of the Ekiti integrity, showcasing the Ekiti origin, religion, culture, and political struggles from the past to the present. People of the fountain.
We just keep trying to help the society and to help the people that we serve. But who is helping us? So if an opportunity does present itself to many of us, that is the right opportunity that wouldn't entail you having to lose years or lose time in your service and everything, my brother, we will jump at it and we will take it. Because our government is not showing enough dedication to us staying behind and helping the system, continue to render our system service to the system.
People of the fountain,